Hello, welcome to BNF Nursing. In this video, we will talk about the pathophysiology of asthma, clinical manifestations, triggers and risk factors, early warning signs, interventions, diagnostic tests, and patient education. The pathophysiology of asthma. Asthma is a chronic inflammatory lung disease that causes varying degrees of obstructions in the airway. The inflammatory response is marked by airway inflammation, hyperresponsiveness, mucosal edema, and mucus production, which makes it harder for patients to exhale rather than inhale. It also causes partial or total obstruction of the airway, interfering with airflow and oxygen supply. Additionally, the irritability of the airway and hyperresponsiveness both result in an inflammatory reaction and bronchoconstriction. The inflammation may lead to air trapping in the lungs, also known as hyperinflation, and retention of carbon dioxide. The obstruction of the airway and retention of carbon dioxide may eventually lead to respiratory acidosis. During an acute asthma exacerbation, patients may experience status asthmaticus, a respiratory arrest which is a life-threatening medical emergency that occurs when an asthma attack does not respond to standard treatment. Clinical manifestations. As students, it is very important to know the expected early symptoms of asthma. Patients may come to the hospital with some of the following expected symptoms: coughing, bilateral wheezing, dyspnea, shortness of breath, and chest tightness associated with airflow obstruction that are often reversible with treatment. Danger signs, such as cyanosis of the lips, fingers, or skin, an increase in the work of breathing, like nasal flaring, chest retractions, absence of lung sounds, sudden absence of wheezing sounds, inability to talk in full sentences, and trouble walking due to shortness of breath may be indicative of impending respiratory failure. Coughing up thick and sticky mucus, audible wheezing heard on auscultation of the lungs as air passes through the narrowed bronchioles, significant dyspnea, shortness of breath, marked by a feeling of chest tightness, labored, rapid, shallow breathing with use of accessory muscles and possible chest retractions. Agitation or anxiety due to inability to get enough air. Air trapping due to obstruction of airflow may lead to retention of carbon dioxide and respiratory acidosis, while hyperventilation may lead to respiratory alkalosis. Patients may also develop hypoxia. Asthma triggers and risk factors. Possible extrinsic triggers that can provoke an asthma attack include allergies to substances such as dust mites, pet dander, pollen, floor dust, and mold. Intrinsic asthma may be caused by exposure to viral infections, cold air, and underlying health conditions like gastroesophageal reflux disease, GERD. Other risk factors include genetic tendency, such as a family history of asthma or allergies. Exposure to medications such as beta blockers and NSAIDs may also trigger an asthma attack. Inhalation of irritants like cold air or air pollution. Repeated or intense inhalation of irritants such as tobacco smoke. Exercise, which may trigger exercise-induced asthma attacks because a large volume of air rapidly moves in and out of the lungs during exercise. Educate patients to use long-acting beta agonists, LABA, at least 5 to 20 minutes before engaging in moderate or vigorous physical activity to prevent asthma attacks. Stress and repeated exposure to upper respiratory infections, especially in adults. Interventions. Get the baseline of the patient's vital signs. Monitor pulse oximetry and assess the lung sounds. Obtain a history of allergic reactions to medications before administering the prescribed medications. Administer short-acting beta-2 adrenergic agonists, SABA, such as albuterol, which are mostly prescribed as the first line of treatment for acute symptoms. Position the patient in a high Fowler's position to expand the lungs. Administer oxygen as prescribed for hypoxemia. Monitor the peak flow rate to evaluate the effectiveness of treatment and measure the severity of asthma. Treatments for asthma. The first step is to evaluate a patient's stage of asthma. Staging is currently prepared using the Asthma Action Plan. The medications used during acute attacks are bronchodilators. Short-acting beta-2 adrenergic agonists, SABA, like albuterol, levalbuterol, and perbuterol, are the medications of choice for relief of acute attacks. They are used at the time of exacerbation for prompt relief of airflow obstruction. Anticholinergics like ipratropium, a bronchodilator, are also used to relieve acute bronchospasm. Systemic corticosteroids, which are anti-inflammatory agents like methylprednisolone, prednisolone, and prednisone, may be used to reduce hyperresponsiveness and airway inflammation. Long-acting beta-2 adrenergic agonists, LABA, are used in conjunction with anti-inflammatory medications to control asthma symptoms and should not be used for immediate relief of symptoms. Note that short-acting beta-2 adrenergic agonists, SABA, like albuterol, are rescue inhalers and should not be used daily. Long-acting beta-2 adrenergic agonists, LABA, are used daily to control asthma. For patients who have evidence of infection like bacterial sinusitis, fever, or purulent sputum, antibiotics may be prescribed in the treatment of acute asthma exacerbations. Diagnostic tests. The pulmonary function test is the main diagnostic test. Spirometry is used for this test, and it measures and identifies reductions in vital capacity and reduced peak expiratory flow rate. It is good to note that the peak flow meter measures the highest airflow during a forced expiration. Arterial blood gas analysis may be used to evaluate if a patient is having respiratory alkalosis, as carbon dioxide is blown off rapidly in breathing, or respiratory acidosis due to air trapping in the lungs, which leads to retention of carbon dioxide. Patient education. Teach patients how to use the peak flow meter and aerochamber or spacer with inhaler. Educate patients on how to use the asthma action plan and what to do in each of the zones: green, yellow, and red. Encourage regular walking and swimming exercise to reduce stress. Encourage good ventilation in the house, use of air conditioning, and air humidifiers. Educate patients to recognize and avoid triggers. Encourage the use of controlled breathing techniques like pursed lip breathing before, during, and after activities that may trigger an asthma attack to reduce anxiety and panic attacks. Educate patients to take prescribed medications as scheduled and use the written asthma action plan as suggested. Thanks for watching. If you found this video helpful, kindly subscribe to our channel. Like, share, and click on the bell icon for more educational nursing videos.